Hi, I'm Dr. Jennifer Hoffman. I'm a physical therapist and orthopedic certified specialist in the Washington, D.C. area and a proud member of the American Physical Therapy Association. Over the past 18 years, I've treated everyone from deconditioned hospital patients to professional athletes, and they all have the same thing in common. Physical activity is important for everyone's health and well-being and should be a part of everyone's daily routine. The exercises I'll introduce you to today, you can do safely in your own home. I'll start by showing you the basic level exercise and then its progression. Once you find the exercise appropriate to your fitness level, pause me, perform your sets and reps, and then fast forward to the next exercise in the program. If you're new to fitness, then I would suggest you perform 10 to 15 repetitions of the lowest level exercise. If you're more fit, I would then suggest that you do 15 to 20 reps of 1 to 2 sets of the higher level exercises. But what's important is not how many sets and reps that you can do, but the quality of the repetitions themselves. If at any time during the program you get winded or lightheaded, take a break, pause me. I know my husband wishes he could do that in these close quarters. Also, whenever you start any new exercise routine and you're unable to tolerate the full 20 minutes of exercise, it's just as beneficial to your health to take that time and divide it up through several bouts throughout the day. So perhaps 5 4-minute bouts of exercise. Also, any new exercise routine, if you're unable to tolerate the full 20 minutes of exercise, it's just as beneficial to your health that you break up the 20 minutes into perhaps 5 4-minute intervals of exercise throughout the day. As you become more fit, you can then work your way up to 10-minute bouts of exercise, and then work your way up to 20 minutes. The exercise I will demonstrate with you today, I use in my own office to treat patients with movement dysfunctions and strength deficits in the knee, the hip, the back, and the lower abs or core musculature. The exercise I will demonstrate for you today, I use in my own office to treat patients that have movement dysfunctions and strength disorders in the knee, the hips, the back, and the lower abdominals or core musculature. You can do these safely in your home. You can do them on the floor, on your couch, on your bed, or outdoors. Any place that gives you a little peace of mind in these chaotic times. No equipment's needed, but if you want to make it a bit harder on yourself, you might find yourself a belt or a robe tie, perhaps some light hand weights or some cans. If you're a higher level fitness person, you can try getting yourself maybe a deflated soccer ball or slightly deflated playground ball, 2 foamy pillows or a couch cushion, and maybe a towel to throw over top. And remember, exercises increases endorphins, and endorphins make you feel better. We could all use a bit more of that these days. They can keep us in, but you can't keep a good person down. So let's get to work. I'll meet you on the ground for some hamstring exercise.
All right, hamstring stretches. We've all done these. You can do them standing up and bending over, or you do a version of the same, sitting down and leaning over. Okay? But often we do these wrong. So here I can touch my toes, but my pelvis is actually pointing backwards. Okay? I'm really just stretching out my lower back. In order to stretch my hamstrings, my pelvis actually has to come forward. My pelvis is up and coming forward, and now I'm stretching my hamstrings, and I cannot touch my toes, but I can really feel it. So I'm going to teach you a way today you can stretch your hamstrings out without hurting your back. So you're going to lay on your back, hands on your thigh, hip about 90 degrees. You're going to stretch your leg out. 1, 2, 3, 4, 5, and relax. And then up, 1, 2, 3, 4, 5, and relax. If you have patellofemoral issues, a little knee arthritis, if that bothers you, just take yourself that handy belt I said to get, do a little loop in it. You can put it on your foot, and then just kind of use that to pull your leg up here. 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. You don't want to like pull your whole leg up because legs weigh a lot. Okay, you want to do 1, 2, 3, 4, 5, and relax. I would do 10 5-second holds on each side.
All right, single knee to chest stretching. Lay on your back. You're going to bring one knee to your chest, like this. You want to grab under your knee, on your thighs. We're not compressing our patellar femoral joint and our knee joint. You bring it to your shoulder, not to midline. That stretches your glutes out too much. To your shoulder. You're going to hold it there 30 seconds, okay? You kind of push this leg down. That stretches this hip flexor out. You don't want your back to arch up. That'll hurt your back. Belly button in. Hold 30 seconds. 30 seconds is a long time when you start to count it out. And then slide this leg up while this leg is here so we don't hurt our back. And then relax. Then you're going to do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. If you want a longer stretch or a better stretch on this side, if you're on your bed, just kind of let this leg go off the end of your bed, and that'll give you a stronger stretch on this side. Okay, and then back up. The other thing to think about is you want to make sure when you put this leg down that you keep that kneecap to the ceiling. Don't let it roll out. Keep it to the ceiling. Okay, what I would do is do 30 seconds, 3 reps on each side.
Now we're going to do the bridge. You're going to lay on your back, feet shoulder width apart. You can use a pillow or a towel roll. Hands on your hip bones. Okay, we're going to lift up by squeezing your bum. Don't lift so high that your pelvis is flat. Your hips are straight. Lift up 1, 2, 3, 8, 4, 5, and down. 1, 2. Notice my hips are not perfectly all the way up flat. They're slightly bent so you don't hurt your back. 4, 5, and down. 1 more. Squeeze your bum. 1, 2, 3, 4, 5, and down. Now that's the basic level bridge. If this is your stop, get on off this train. And if you're looking to go from next level, here we go. Get yourself your TheraBand or a belt. Okay, here's a TheraBand, just a stretchy elastic band. You can put it here around your legs. If you just have a belt, which most of you will have, you can get it, tighten it up around your legs in the same location. Using the TheraBand or the belt, you're going to push out against it. Helps you kick your glutes in more. Okay, so we're going to do the same thing, basic bridge, but now by using the belt or the TheraBand, it makes you use your glutes more. Same concepts apply though. Up, 1, 2, 3, 4, 5, and down. Again, 1, 2, 3, 4, 5, and down. 1 more. 1, 2, 3, 4, 5, and down. All right, next level up. We're going to do a kick. Now you can do this level with or without a band or a belt. What you want to make sure is that your pelvis stays level. You breathe normal. Keep your belly button to your spine. Okay, so we're going to lift up and then kick one leg and then the other. Here we go. Ready? And 1, 2, 3. 1, 2, 3, and down. Okay, and again, kick. 1, 2, 3. 1, 2, 3, and down. Now when you kick your leg, you also want to make sure you keep your kneecap facing towards the ceiling or the sky. You don't want to roll your knee in. Keep your kneecap to the sky. That makes you use your quads and not your tensor fasciae lata IT band, okay? Makes you use the right muscles. And again, and 1, 2, 3, and 1, 2, 3, and down. So what I would do, if you say you're doing 20 of these, I would start off kicking 10 on one side, and then I would kick 10, starting off 10 on the other. So each side you start off with. Okay, next level, get yourself a ball, put under one foot, and straight. You're gonna lift up, 1, 2, 3, okay, foot back on, belly button in, 1, 2, 3, 1, 2, 3, okay, you're gonna do that on each side for the unstable surface. Okay, and switch feet. That's for bridges. Next exercise up is clams. See you there.
All right, now everybody's favorite, clams. You're gonna lay on your side.
You want your ankles to line up with your hips, your back, and your head. Hands on your hip bone. You want to make sure your hip bones are level. You don't want to be sagging. Okay, level hip bones. Belly button to your spine. Ankles stay together. You're going to open your legs up like a clam. So you want to be one with a bivalve here. Just like that. Okay, belly button to your spine. You notice my back, just my hip is moving. I'm not rotating my back. Okay, just my hip is moving. This way you're working your glute med, you're stretching your TFL, and you're working your lower abs or your core muscles. So you get 3 for the price of 1. That's my idea for shopping there. Okay, you should feel it right here and a stretch here. All right, this is the lowest level of clam. People tend to like this one. It really gets you right. Woo, I can feel that one right here. Okay, the next level up, if you happen to have a TheraBand, you can use this. You just put it right here. Just adds a little bit of resistance, which goes a long ways in this exercise. Same concept though. Okay. The next level, all right, so the next level I call clam with dog peeing on a fire hydrant. I know, but you'll understand when you see it. So you're gonna do a baby clam, then you're gonna lift your leg up like a dog peeing on a fire hydrant. Just like that. Now you get it, now you get it. Okay, back stays still, just the hip moves. So a little baby clam, dog peeing. There you go. Knee stays higher than your ankle. 1, 2, 3, and down, just like that. This stays. You'll feel that core working, you'll feel the glutes working. Just like that. Okay, now I'm not bowling my knee up here, I'm actually taking it back towards the fence. Okay, baby clam, dog peeing. I know, I'm very zen around here, very zen. Just like that. Ooh, I'm already feeling that one. This leg's gonna be really tired. Okay, so that's another level, all right? If you're ready for the next one, it's gonna be straight abduction. Okay, a lot of people do this exercise. A lot of people do it wrong, okay? So what we wanna do is you wanna lift your leg in the plane of your body, so straight in line with your body. But what I want you to do is that kneecap needs to be slightly to the ceiling, not angled down, which is what a lot of people do, and you're not gonna come forward at all. Straight with the plane of the body. Slightly up with the knee. Okay, belly button in. We don't want anything to move here. This stays solid. You're gonna lift it straight up and back down. Whew. I feel that. Straight up and down. Now one thing you can do if your back is moving a lot, because that will work your core strength, you can do it against a wall a little bit to help you stabilize some. It'll also keep the light in line with your body a little bit more. See, now I can kind of keep it going a bit more, and then you'll feel if you rotate into the fence, you'll feel it stop you. Okay, and that gives you a little bit of feedback if you're rolling back into the fence or your wall or your couch, whichever one you're using. Okay, so you don't want to be right on the fence holding you, because then you won't have to use your muscles, but you'll feel it push against you a bit for a little biofeedback, as we call it. Then you just lift straight up. Okay, make sure you're not rolling the knee in, because then you're using your tensor fascia lat IT band. You're not going to be using your glutes so much. And straight up. Okay, the next level after that one, okay, you're going to do the same thing, but instead of lifting it straight in line with your body, you're going to lift it slightly back, but keeping the kneecap to the ceiling. Okay, this is a real kicker in the bum there. All right, so you're going to lift it straight back and up. All this should stay again. This should stay still, just the leg moves. That's how you work that core strength. Yep, there it is. Woo! Feel the burn. Feeling the burn. Just like that. Everything stays here. You can use your hand to feel if you're moving or not. Belly button in. Make sure you're breathing normal. Okay, make sure you do both exercises on both sides. Got to keep everything even. Okay, just like that. Woo. All right, next exercises, we're going to do standing side steps. I'll see you there. All right, we're ready for sidestepping. As you can see, this is my kindergarten homeschooling at work. We've been working hard this week for our backdrop and preparing to shoot this exercise video. So I told my son I would use it as part of our backdrop. So we're going to do our sidestepping, and when you do side steps, the farther you can squat down, the more you'll use your glutes. If squats bother your knees, you can do a stand up or just a little baby mini squat. It will still help you. No equipment's needed, but if you have a TheraBand, it will make you feel it more. Now when you're doing a squat, you want your kneecaps over your first and second toes. Don't let your knees come past your shoelaces. You're going to squat. Make sure you're bending your hips like we talked about with the hamstring stretches. And then you're just going to sidestep. Okay? Just like it says, sidestep. So what you want to do is you want to do your squat and then you're going to sidestep. I like to rotate my feet out some. Make sure you work your glutes more. You don't want to rotate your knees in and sidestep like this. That's not the idea. Keep that external rotation going. So maybe you do 15 or 20 one direction, then you do 15 or 20 the other direction. Keep it even, okay? And if you have a handy dandy TheraBand around, it makes it all the more fun. Put that around your knees here. That keeps you from, it pulls you in, makes you roll your legs out more. Kind of like doing slides in basketball. Okay, and there you go. Next exercise up, sit to stands. Now we're going to do sit to stands, the lowest level of our squat progression. Whenever you stand up from a surface, you always want to make sure you scoot to the front of the chair or couch or bed or whatever it is. Makes it easier to get up. And then you're just going to stand up and sit back down. What you want to make sure that you do is that you have a nice sturdy surface that you're standing from, a bed or a couch, a nice heavy chair. You want to make sure it's not so high it's too easy for you, or not so low that it's too difficult and you end up sitting back hard, falling over, knocking the chair over, and so forth. Challenging, but not too hard. So you're going to stand up and back down. Just like when we were talking about with the sidestepping, you want to make sure that your kneecaps do not go past your shoelaces, and your knees should be over your first and second toes. We don't want your knees rolling in. So it should be a stand up and then back down. So that'd be 1, 2, okay? Try not to use your arms here or on your legs, okay? And 3, okay? You can also get a couple of light cans. You can do a few bicep curls with it. All right, so that would be the sit to stand. The next level would be what we just call a chair squat. It's like a freestanding squat. It just makes sure that you're working on your technique properly. So, just like with the hamstring stretches, when you're squatting, you want to make sure you're bending your hips. So, kneecaps over your first, second toes. Don't let your knee go too far forward. Bend your hips, keep your back straight. Tap your bum and back up. So that'd be 2, 3, okay, 4. You can use some light weights if you need to make it a little bit harder. 5, 6, or you can throw them out in front of you like that. That'll kick your glutes in a bit more. Okay. To make it harder, you can also use your TheraBand. Place it around your knees or your belt. Make sure you maintain your balance. Always makes it harder. Makes your glutes kick in more. Okay, the next level will be just a free squat. Same concepts apply. Shoulders, feet shoulder width apart. I always put my hands on my hip bone, make sure my hips are moving forward. Maybe 1, 2, 3. Again, you can use a TheraBand. You can use a weight. A gallon of milk weighs about 5 pounds. So you can take it. 1, works the shoulders, works the glutes. 2, 3, 4. Okay, and our highest level part of the squats is your 2 pillows or a couch cushion. This is my couch cushion. Already covered it with a blanket. All right, unstable squats. All the same concepts apply. Kneecaps don't go past your shoelaces. Your knees should be over your first, second toes. Bend your hips. Feet shoulder width apart, and we squat and up. Squat and up. It just uses more muscles because it challenges your balance. To make it harder, you can use some cans. You can use a TheraBand. I'm gonna get our handy dandy milk jug, 5 pounds. 1, 2, 3. All right, that's it for me. Thank you for joining me. Good luck. We can do this. For more information on what physical therapists can do for you, visit ChoosePT.com.